We were very happy to see that adverse events and serious adverse events did not seem to be at any difference in rates between azacitidine monotherapy and a combination of drugs. The primary endpoint of this study, as it was designed, was event-free survival, and event-free survival favored the combination of pevonedistat and azacitidine at 21 months compared to 16.6 months for those patients who got azacitidine, with a trend toward significance. The study wasn't powered to see any difference in overall survival, although numerically that did favor the combination at 22 months versus 19 months for azacitidine. When we drill down to patients who have higher risk MDS, the median event-free survival was 20 months versus only 15 months for those who got azacitidine, and that was a significant difference. And the median overall survival was 24 months for those who got the combination versus 19 months for azacitidine. If we instead focus on those patients who had low blast count acute myeloid leukemia, the median survival was again about 24 months for those who got azacitidine and pevonedistat versus only 16 months for those who got azacitidine, with a trend towards significance. So what we were able to conclude from this study is that the combination of the two drugs was tolerable, and by tolerable we mean that the adverse event profile really didn't differ from those patients who got azacitidine alone, and there seems to be a strong signal of activity for the combination in improving, in particular, event-free survival, and for patients who had low blast count AML overall survival compared to the azacitidine monotherapy.